Okay. Yes. Should I start? Just so everyone knows, you are automatically muted. So if you're trying to find the mute button, you're okay. Okay, I think we're probably going to go ahead and get started because we have an action-packed program here for you. And I will apologize ahead of time. My dog likes to participate, so I will try and keep him on mute, but no guarantees on that. My name is Tracy McDonald. I'm the Executive Director for the Southern California chapter of Autism Speaks. I'm also the mother of Griffin, a 22-year-old adult with autism. I don't know about you guys, but I'm having a really hard time even knowing what day of the week it is. But I am so excited. I've so been looking forward to this webinar because I think this is one of the things that Autism Speaks does the best. I'm hearing there's no sound. Is anyone?
Tracy, I can hear you. This is Kelly.
Okay.
It looks like other participants can hear you, so it may be on Shelley's end.
Okay, just checking. Because I was being really brilliant on that. No, I'm kidding. And there he goes. So in times like this, especially, I think this is where Autism Speaks is so incredibly important. I think our mission remains the same to promote solutions across the spectrum and throughout the lifespan. And I think especially now, it is so important to have a national organization that really is working for all the families, especially when we're talking about COVID-19. We have an amazing panel of people here today. So sorry. That are going to talk about what we're currently doing on a federal and state level. And I think the most important part is that all of these individuals aren't here just for this seminar. They are working each and every single day for our families and what we're doing. So I for one, am completely appreciative of all that they're doing because I can't keep track of everything that's happening, and God love them, they're all really on top of all this. We do want to invite everyone to join us on Saturday. We are doing a Steps for Kindness event. It is a virtual event, and it's really just to get the entire autism community together across the country. We know that autism in and of itself can also usually be really isolating, and especially in these days, it's even more isolating. So we just invite you to step out, walk in your house, walk outside, social distance, and take 5,400 steps. That's for the 1 in 54 children impacted by autism. It is a Facebook Live event, so you can register for that, and we really hope you'll join us. And I'm going to turn it over to Judith, who is a remarkable advocate for each and every one of us. And thank you once again for joining us. We're very excited you could be here.
Thank you, Tracy. And I always have to share this story, but when my son Jack was diagnosed with autism at age 2, I was very lost, and we'd received a diagnosis, but really not much of a plan or any sort of hope at all. And I had attended an event where Tracy was speaking, and she was the first person who gave me any idea that there was hope and this was something that we all could do. And so she is one of those people in my life who I'll never forget. And so I can never say thank you enough, Tracy, for being there for me when I needed it. And I hope today, during this time of crisis and upheaval, we can be there for you while you need it. I know people are walking different paths right now, or what is the analogy that's going around? We're all going through the same storm, but we're in a different boat. And so your boat might look quite different than mine, but the storm is raging and we're all, really tossing and turning and doing our best. So we want to just connect with you today, share information. Some of it's a little wonky. It's important though. that you be aware of what's going on in Washington, D.C. On behalf of our community, and things that could affect our community, and then also in Sacramento and statewide. So we're going to share that information, and then we're also going to share information about resources that we have for you as you're going through this time, whether you're a self-advocate, whether you're a provider, a parent, a sibling, a grandparent, someone in the community who supports people with autism. We want to connect with you today. So thank you for taking time to Zoom in. And we're going to get started first with Dave, who heads up our federal team in Washington, D.C. And he's going to walk you through what's going on there. So Dave, make sure. Yeah, you're good to go.
Thanks, Judith. It's great to be with you all today. Actually, Judith, did you want to go back to that slide first, or?
I always just want to skip this slide.
Yeah. It's an important one, so.
Yes, thank you, Dave. Before I turn it over to Dave, we do just have some examples of things that the community is going through. This is a path, you know, that we're all walking down, and we don't know where it's leading. It's unfamiliar. And so, as you all know, educational programming is out the window. Day programs are not available. Clinics that you might access aren't available. You're utilizing telehealth. I know for my son, Jack, screens he's not really interested in, and so it's been very difficult to get him to engage in any sort of tele-education or telehealth. Lack of connection to your communities. Jack likes to go to Outback Steakhouse every Saturday night. It's so important to him, and we can't do that right now. There's a disruption of employment opportunities for people with autism, and that's such an important economic thing, and also just a connective thing that means so much to a person. Routines are up in the air, respite's not available, income is lost for families. People are losing their jobs, or they're out on leave, and it's very difficult. Many in our population have challenging behaviors that spike during times of anxiety and crisis, and that's really hard to live with, especially when there's no place to turn. It's very difficult. And then, of course, we want to make sure that we're aware that access to healthcare is a problem for people. You know, people are in some parts of the country are even afraid to access healthcare because they're afraid they might not be able to visit their loved one with autism. There are issues around that. So it's just such an uncharted path that we're all on. And so that's what we want to touch on today. So now, Dave, if you would tell us federally how you're going to fix all that, we would really appreciate it.
Thanks, Judith. And I think that slide is just so important because I think it's helpful to show where we're coming from when we're advocating at the federal level, at the state level. Like, these are the types of things that we're keeping in mind and trying to inform legislators about, so we can have positive policy solutions that are helpful for the autism community. So what I'm going to do is go through a very high level overview of what has been happening in Congress related to COVID related legislation and actions. So talk about where we've been, where we think we're going, and what Autism Speaks is specifically engaged on. I am going to say at the outset, I'm not going to get to every last detail of this. I could go on for probably several hours in terms of all the specific elements of these bills. And so, and some of the implementation as well. There's been a lot of specific things that have come up. So please, if you have questions, put them in the chat box, and we'll, or in the Q&A box, I should say, and then we'll try to get to as many as we can on the call, and then if we're not able to, we'll get back to you at ASAP. So, in terms of where we've been, you know, in the parlance of Washington D.C., there's always some type of jargon used, and for this crisis, for the legislative bills that have been, or the legislation that has gone through, they've all been kind of referred to as the COVID-1, COVID-2, COVID-3 bills. And so going back to the first major action that was taken related to this crisis on March 6th, there was the Coronavirus Preparedness and Response Supplemental Appropriations Bill. So the March 6th bill, which was kind of the first effort to provide some public health funding for the response, and there were several other small business and other provisions in there, but it was really the first bill that went through. The second one on March 18th was the Families First Coronavirus Response Act. And that bill included some more individual and family specific provisions to try to provide assistance during the crisis. So one of the big things that came out of that was an emergency paid sick and family leave policy that is available to employees of employers under that have like less than 500 employees. And we have more information that we can help provide as on the specifics of that. There were some tax credits. There was free COVID-19 testing, which I know has been a challenge to access, but that included some provisions to allow people to get access to that for free, some food assistance, and of course, some important Medicaid funding. So that was March 18th, and then several weeks later, on March 27th, the Coronavirus Aid, Relief, and Economic Security Act, it's also known as CARES or COVID-3, was passed, and this was the really large piece of legislation that I'm sure all of you have heard about, that included $2 trillion worth of relief, and that included the economic impact payments, which are the $1,200 per person, $500 per dependent under the age of 17 that will be going out to most individuals across the country automatically. And I'll get to some of those, some of the things that have popped up related to that in a minute. Increased unemployment benefits. So this is the add-on of $600 on top of per week on top of existing unemployment benefits. Hundreds of billions for the public health response to state and local governments, assistance for small businesses and other employers to retain employees. So this is otherwise known as the Paycheck Protection Program, which has been in the news quite a bit recently, to provide forgivable loans to small businesses and businesses under 500 employees. And then, of course, billions of dollars. There's about $13 billion of funding that went to elementary and secondary education to try to assist during the crisis. And then lastly, the extension of money follows the person. When I say lastly, the last thing on this particular list, because there's a lot more that is contained in that legislation. Judith, would you mind to go to the next slide, please? Thanks. So in terms of implementation of the various COVID bills that have come up, I just wanted to talk about a few issues that have come up in particular in our community and things that we've heard about a lot and try to address and provide information on. So the $1,200 economic impact payment and $500 for dependents under age 17, those are being distributed automatically to anybody who filed their taxes in 2018 or in 2019. Initially, there was some challenges, really, and there still are some challenges, but initially there was some confusion, I guess, around what would happen for Social Security beneficiaries and for SSI beneficiaries. The IRS, over the course of the last few weeks, has said that SSA, so anybody really receiving old age and survivors, Social Security disability, and SSI will receive their benefit payments automatically. The $1,200, I'm sorry, not benefit payments, the economic impact payments automatically. There was an issue because if you didn't file taxes and you were a Social Security beneficiary or an SSI beneficiary, then how were you going to access this? So they did close that gap. However, if you are an SSI or an SSA beneficiary and you have dependents, in order to be eligible for the $500 dependent credit, you need to fill out a specific form through the IRS website, and we can provide that resource for you as well. There's a lot of confusion around this. I hope I'm being as clear as I can, but I'm happy to answer specific questions around in the Q&A. In terms of the distribution of education dollars, as I mentioned, the last legislation that passed, or actually now there's been action since then, but the $13 billion that I mentioned will be distributed to states and then distributed through formula. And then each governor is going to get an allocation of money as well on a separate pot that was established. We are continuing to advocate to, and Judith and can speak to this as well later on, that at the state level, that and state and local level, that some of these dollars are devoted to special ed, and that we're ensuring that our community is recognized in this. And so those dollars will be going out to states to provide relief, but we know there's going to be more to do, and I'll get to that in a second. IDEA waiver report. So one of the concerns during the consideration of the COVID-3 bill was that there might be a blanket waiver of IDEA protections included. Autism Speaks actually spoke out against this idea during the consideration, the negotiations related to this bill, and ultimately there was no blanket waiver of IDEA included in the COVID-3 bill. However, there was a report required that the Secretary of Education will issue within 30 days of the bill passage. So actually it should be coming out shortly, about any potential waivers that might be necessary. And she'll submit that report to Congress. It will then be up to Congress to take any additional action. We've been opposed to any waivers of IDEA, and we haven't seen this report yet, but that's been our position, and we've signed on to some letters that have, or at least one letter that has indicated that. And lastly, the emergency paid and family leave. I just wanted to provide this update because it was important. Initially, the way that the law was structured, there was some concern that this wouldn't apply to caregivers of adults with disabilities whose day center or other source of care had closed down, as it is available for children whose school or daycare center is closed. And we advocated, and many others advocated as well. And fortunately, the Department of Labor clarified that those individuals would be eligible. If you go ahead to the next slide. Federal COVID legislation, the current state of play here is that there was actually a COVID 3.5 bill that was passed in the Senate yesterday, and it will be considered in the House tomorrow. And this was to address the Paycheck Protection Program, that small business assistance program that basically ran out of funds. They had $350 billion in there, and there was such high demand that it ran out, and more was needed. So this was kind of an interim bill to address that specific issue, and also provide funding for hospitals and testing. In total, the bill is about $500 billion. So we expect that will pass in the House later this week, or at least that's the intention, is bringing it up tomorrow. Then going beyond that, there is a lot of discussion about additional relief and stimulus. We're very unclear right now at this point as to what would be included in that. The House and Senate have announced they're not coming back until at least May 4th. There's still discussions that are going on, but really those negotiations are very much in flux. And so you see there's a list I just put down of potential things that would be included, but in terms of specifics, it's unclear at this point. So let's go to the next slide, please. So throughout this crisis, we've been advocating with members of Congress, talking a lot with our legislative champions, and trying to ensure that the voice of the autism community is heard. So some of the specific priorities we've been advocating on are additional funding for home and community-based services, expanded access to telehealth services for healthcare needs. I know Judith touched on that. touched on both of those as well in that previous slide. Additional funding to meet the educational needs of students with autism. This is both to ensure that we're doing everything, or that school districts are able to do everything they can to provide services to educational opportunities to students right now, but also to ensure that when students get back, that some of the compensatory services that are going to be needed are taken into account, and that there's money available for that. We talked about the IDEA and just trying to ensure that the rights of students aren't rolled back, and as well as the paid sick and family leave. And lastly, preventing discrimination and treatment decisions based on disability. There's been a lot of concern raised about that, and we've kind of joined with others in the disability community to speak out. So, we're really grateful. We have amazing co-chairs of the Autism Caucus in Congress who have sent a letter to congressional leadership. They actually sent two over the course of the last month to express some of these concerns and request additional support. So I'll stop there. I'm happy to take additional questions, and we'll go from there.
Great. Dave, we have a question that is asking for a little bit more detail on why we would oppose waivers to IDEA. Can you explain generally what our philosophy is, and a little bit more background for those that may not be familiar with IDEA?
Sure. So I guess the basic concern we have is that we think that it is possible to continue to provide services for students without necessarily rolling back protections that have been afforded under the under IDEA. And we totally understand that that school districts are under a lot of pressure right now, and that it's a very challenging situation, and that a lot are doing the best that they can with the resources they have. I think that we're just concerned that in this really challenging time, that the kind of the protections that have been in place for years aren't rolled back. And so what I'll do is I'll provide the letter that we signed on to in the chat box here. So you can see kind of a longer version of this in terms of some of the principles that we have joined in agreement with. But that's generally where we've been on the issue. And I don't know, Judith, if you have anything else you would want to add to that.
Okay, I don't think Judith does. She's not coming off mute. We have another question that is asking maybe for a little more detail about supports for family with children or adults with special needs, including autism. I think when Judith speaks, you'll hear a little more detail about what we've requested. So we'll let that one happen in Judith's presentation. We have one asking about, are we partnering with other nonprofit organizations in the intellectual disability space, so the Down Syndrome Network, Special Olympics, and so forth. I know we have done some collaboration. Dave, you want to go into any detail on that?
Yeah, I mean, we've been talking quite a bit with some of the other organizations that are engaged in this space. So the Autism Society of America, for example, and talking with them and working kind of collaboratively with them in our discussions with the congressional offices. We've joined on to some letters that others in the community have put together, including this IDEA letter that I'll share shortly. So, I don't have the full list of everybody we've collaborated with, but we're certainly staying in touch and are a part of a lot of those discussions with other organizations. And actually, just going back to that first question, I'll just quickly say that we are in terms of the home and community-based services, I think that we are advocating for more funding for that, and I think that could hopefully be helpful for a lot of people across the spectrum and across the country if that is boosted.
Great, thanks, Dave. We have a question about IEPs that I think may get answered with Judith's presentation, so we'll let that one happen. And we have a question about what parents can do, autism parents can do to help with advocacy. And we are going to do a follow-up email to you that will start that process if you're not already engaged with us, asking for some information from you about how you've been affected that helps us advocate with legislators. And we'll encourage you, if you're not already signed up, to receive our action alerts and things. A lot of the work has been channeled through, at the state level at least, has been channeled through more the administration level than legislators. But we will definitely keep you informed if there are things that we want to request voter constituent support for. So I'm going to go back to Judith, and please keep, these are great questions, keep posting questions that you're interested in hearing, and we'll address them after the relevant section. Thanks.
Great, thank you. And I think I'm unmuted now. So now we're going to move to the state response to COVID-19 and how it's affecting families across the state. So the first thing I want to do is, I don't know that I told you before, but I'm Director of State Government Affairs for Autism Speaks. So I work with state legislators and regulators to try to make sure that our community is represented in a meaningful way. But it's really important that we have someone on the ground in Sacramento all the time. And we have an amazing contract lobbyist named Melissa Cortez Roth, who's actually going to join us right now. She represents Autism Speaks and has been doing so for many years and does an amazing job. So Melissa, if you could just give us the scoop about what is going on in Sacramento, we would be so appreciative.
Sure. So again, I'm just going to provide a very broad overview of what's going on, and then hand it back over to Judith for some more specific state information. So on March 4th, the governor issued a state of emergency, and then on the 19th, of course, we got the statewide stay-at-home order. There were some local jurisdictions who had acted even sooner than that, though. The legislature is currently on recess until May 4th. Prior to adjourning, they did pass legislation appropriating up to $1 billion for any purpose related to the state of emergency proclamation. And so far, it's been reported that about $650 million of that has been appropriated to address the current pandemic. While nothing is official at this time, it's highly anticipated that when the legislature does return on May 4th, that's assuming they do return on May 4th, that they will focus exclusively on issues related to COVID-19, homelessness, and wildfires. So what that means is that if there was any legislation that was introduced or intended to move forward this year that was outside of those issue areas important to the community, it likely will not move forward. Those are the only 3 issue items that will be addressed given our new normal. Both houses have had informational hearings, and that was done with legislators, the Department of Finance, and the Legislative Analyst's Office, all participating remotely. So, we're still trying to figure out how we can do these things and still have public input. And they did have public input at those hearings. It was all done via telephone. But we are still, as a state, sort of working out the kinks and figuring out how to legislate remotely. The takeaway from those hearings is that we are definitely headed back into a recession, unfortunately. The impact of the pandemic on the state budget is going to be severe and is expected to last for several budget cycles. The governor will be issuing revisions to his January budget in May. They do this every year, and they have already said that this year, when they do the revisions in May, it's going to be what they're calling a workload budget. So what that means is that the budget is going to cover the cost of existing services and the cost of projected increases in caseload and nothing more. So of course, that means any efforts to increase funding, expand programs, new services, none of that is likely to move this year. And it's difficult really to project at this time, if there will be any reductions. Certainly, we saw that happen in the last recession. And at that hearing, the legislative analysts cited a possible, up to $35 billion drop in potential revenue. And just to put that into perspective, in January, we were talking about potentially $21 billion of surplus. So the impact really, really has been great. And we're looking at about 85 billion shortfall in the out years over several budget cycles. Now, having said all of that, we are definitely in a better position than we were with the last recession. We do have a roughly $17.5 billion rainy day fund. We can access up to half of that in the current budget cycle. So we are definitely better positioned. And to add on to that, because of the tax delay, once they do pass what will be the workload budget, they are expected to come back and make additional adjustments in August. Once we do have, we know what the general fund revenues are going to be looking like. So I realize that sounds like a lot of bad news, but the good news is that as a state, we're not seeing the number of COVID cases and deaths that were originally projected for our state. And that is, of course, thanks to the early action by the administration as well as local jurisdictions. And, for what it's worth, California as a state tends to respond very well to disasters, be it wildfires, floods, earthquakes. Our leadership acts fast and our community does come together well. So that is the positive of this. And because of that, the governor has actually begun discussions on what it would take to modify the stay-at-home order. He's outlined 6 key indicators. We are in agreement on those indicators with Oregon and Washington. We have a 3-state pact on that. So those 6 indicators are the ability to monitor and protect our communities through testing, contact tracing, isolating and supporting those who are positive or exposed. Number 2, the ability to prevent infection in people who are at risk for more severe COVID-19. So we need to be able to protect our elderly and those with pre-existing conditions. Number 3 on that is the ability of hospitals and health systems to handle surges. So once we do get back to something a little more normal, there is likely going to be an uptick in cases, and we need to make sure that our hospital systems are prepared for that and can handle what will likely be a surge in cases. The ability to develop therapeutics to meet demand. Number 5 is the ability for businesses, schools, and childcare facilities to support physical distancing. When the governor laid these out, he referred to this as redrawing the floor plan. So really what that means is, what does a restaurant look like? Is that, disposable menus? Is that people wearing masks? But more importantly, what does that look like for a classroom? Many of our classrooms are already overcrowded. How do you redo that physical space to account for that? And before we can have the conversation about reopening, we have to have these types of new floor plans in place. And finally, it's the ability to determine when to reinstitute certain measures, such as the stay-at-home, if necessary. So those are the 6 indicators that have been outlined. There is no timeline at this point. Obviously, this is very fluid and there's new information coming out daily. But with that, I am going to hand it back to Judith to talk about some more specific things the state's doing.
Thank you, Melissa. And nothing personal, but it sounds like whatever is going on in Sacramento is pretty sucky right now. I don't have a more eloquent way to say it. But that doesn't mean that the needs of our community don't matter, and we have to figure out how to effectively advocate around them during this sucky time. So we at Autism Speaks, interacted with the community, and as we're facing this crisis, we're trying to look at all the different places that you might turn to try to get help as a person with autism or a family affected by autism. So of course, healthcare is an issue, trying to access help through the healthcare system. For those of you who have waiver services, home and community-based services, that's some place where you might turn even more. And then of course, so many people, as it's reflected in our Q&A, are worried about delivery of special education. Also, we're thinking about early intervention, what's going on in those arenas. And when we think about healthcare and home and community-based services and special ed and early intervention, of course, something that supports all those things is this newly available telehealth. Telehealth has been available for a while, but now it's, the day-to-day reality for so many of us. So those are the areas where we're focusing our efforts. There are many shiny objects we could chase, but this is the focus that we're taking right now. So first I want to talk to you just quickly about healthcare. What exactly are we doing and what's going on? I'm not going to get super wonky and talk about the CMS waiver numbers and all that sort of stuff, but I will say early on in California, CMS granted this emergency waiver, an 1135 waiver, that basically says if you get your health care through Medi-Cal, if that's how you get it, a lot of the provisions and restrictions that are usually there are going to be waived or lifted. Provider screening requirements, they're allowing out-of-state providers, they're suspending prior authorizations, things like that, just to make it easier to keep the wheels of healthcare turning during this crisis. And you all will have access to this after the webinar, so there are links that you can go to find more information about these specific provisions. The other thing I already kind of alluded to is telehealth. Telehealth, it was made available via an all-plan letter that came out early on. It affects all the health plans, and it's important to note that the services shouldn't be reduced or look different. They need to be reimbursed at the same rate. They should be made available. So that I know, of course, in reality, when telehealth services are provided, they can look quite different, and the autistic person might not tolerate telehealth delivery as much, but we still want to make sure that it's available. And so we've advocated around this. Unfortunately, in California, that has been made available. We did know that there were some issues with certain health plans early on. I won't name names where action had to be taken, especially around applied behavior analysis and what that looked like. But that's all been ironed out now, I believe. And this all plan letter, which you'll have a link to, provides really good information around that. The all plan letter also mentioned speech, OT, and other therapies too, just trying to be well-rounded. Okay, home and community-based services. So if you receive waiver services like the developmental disabilities waiver, CMS, which is the federal Medicaid agency, said early on, hey, waiver people out there in the States, we want to try to make things easier for you. And we actually want to expand waiver services somewhat to make sure that we're meeting the needs of the families and the people with autism. So California filed what's called an Appendix K. And Appendix K is something I'd really never heard of until March of 2020, but it's used in national emergencies, and it allows CMS to have some flexibility around those waiver services. So locations can be changed, provider qualifications can be changed, service plan development requirements are quite different. You don't have to do them in person. And these are all things that are included in the Appendix K that was approved for California, and it was approved on April 2nd, World Autism Awareness Day. And there is a link to the Appendix K in this webinar that you can go to and look and see all the provisions that are listed there. But the goal is just to make it easier to access home and community-based services during this time through the waivers that are out there. Okay, moving on now to special education and early intervention. This is a huge issue for our families. I know many people really aren't accessing any sort of special education at all during this time. And of course, children that are in early intervention, they may be receiving some telehealth sort of services, but we're very worried about the quantity and quality of those services, and also what's happening to those that might be transitioning into special education. Is that transition occurring? What does that look like? the other end, when we're thinking about transitioning out of special education, Tracy mentioned the Griffin's 22. So for those who have transitioned out or are going through transition into adulthood, what does that transition look like? Are transition services being made available? Probably not, or it probably is quite disparate depending on where you live in the state. So we're advocating specifically around those sorts of issues with California special education. Dave mentioned before that there's money coming down from the CARES Act that passed in Congress, and there's an education stabilization fund that's broken out into 3 buckets. One is for K through 12, and it has formulas that say kind of how the money is supposed to be allocated. Another's post-secondary education, same deal. They have formulas that say how that should be allocated. But there's also a discretionary fund that's going to be going to Governor Newsom specific to education. And it's not earmarked for special education, but we are going to reach out to the governor and make sure that things like I mentioned, the transition piece, early intervention as transitioning into special education, those sorts of things are appropriately funded. For all the services that are being missed right now, for those of you who are home and not accessing any special education, or perhaps you're just getting just a little bit of it, but it's not anywhere close to what's in your IEP, at some point those services have to be received. And so what is that going to look like? How are those going to be funded? We'll certainly advocate on the federal level for more IDEA money to come to the state moving forward. But right now, with that governor's discretionary fund, we would like to see some of that money spent on delivery of special education services as much as we can now, and certainly down the road as people are able to access their teachers and school in old ways and new ways. The other thing I want to mention too, the final thing is, we want to make sure people everywhere can actually access telelearning. So if you live in San Jose, or if you live in the Redlands or Palm Springs or wherever in the state, what does that look like for you? What do people in LA, what does that look like for you? Do you have broadband access? Do you have the equipment that you need? Are you a family, of 5, living in a 2-bedroom apartment with 1 computer and limited Wi-Fi? Like, what does that look like? Do people have what they need in order to participate in telelearning? And does our community have that? So these are the requests, the things that we're advocating around. And I know that there's a lot more issues specific to special education, but those are the things we're focusing on right now. We're actually meeting with the California Department of Education. Tomorrow is Thursday, I think, Melissa. What day is today? So if you have things to add, I bet you do, that aren't on this list, if you would let us know in the chat box or in the Q&A, Melissa and I are going to be meeting with them tomorrow to share our concerns. So please share those with us. We want to make sure that we're representing you. So I will stop right there and say we're going to do some questions, but I would ask you to please stay in touch with us. We have profiles on Facebook and Twitter and Instagram, so follow us there. And if you want to, you could sign up for advocacy alerts. If you go to autismspeaks.org /advocacy, you have to kind of scroll down a little bit to see where you sign up for advocacy alerts, but please scroll down and do that. We won't spam you too much, but when there's something going on in the state, we want to be able to reach out to you. So please sign up for advocacy alerts, and please follow us on social media too. And with that, I will stop talking. And do we have any questions for Melissa?
Yes, we oh, I'm echoing. Is that better?
Yeah,
we have a few. This first one, maybe Tracy may know, or Melissa may know, if there's something California specific through a relevant department. But the question is, how is Autism Speaks helping adults on the spectrum for employment during the crisis? And they said their landlord gave a list of jobs that people can do working from home, but wondered if we have any additional resources in this area.
That's a tough question. I think, let's see Marianne when she speaks about our resources, if she can fill in the blanks a little bit there, but that might be a piece of advocacy we need to move forward with. Yeah.
So I was thinking that that might be, I mean, I'd love to have Dave Kieran respond to that. And we can do that through the art team as well. So if that person wouldn't mind, we can get back to you probably in the next day and give you some tips on that. I know we're developing this as we go, and this will help us to know that, in this area, this is where adults need support as well. So I'll make sure your email gets to your question gets to the right person.
Great. We can include the reply within the follow-up email since it's an anonymous attendee that posed the question. But I know we have a whole employment initiative, and we're trying to do everything we can to help in this area. And it's a developing program, and we'll find out if there are specific things that may be helpful during this time.
Right. There are some
And
groups.
on that, I will also send you to attach into that. There have been, I don't know if it's related, but the Department of Developmental Services, I think it was, has made some adjustments to the competitive integrated employment incentive payments. So I'll make sure you have that information as well.
Great. Thank you both. Appreciate that. We have another question. A parent of 2 boys with autism currently in different states getting treatment for their specific needs. And they say there's nothing available in California to help support young children in a boarding situation for safety reasons. The facilities have staff going home every night to their families. If facilities get shut down due to COVID, what kind of service options will parents have in California with younger children that are currently unsafe? And why aren't there more options in California? That's a really tough one. I don't know if anyone feels prepared to reply to that one, but I throw it out there as having been asked.
Well, I'll jump in because I've certainly had experiences with other families who've had similar situations. And I think if I were this person, I would go to the regional center. If the child is coming home from an out-of-state placement and is going to be with a family, it makes sense that the regional center would step in with services that can support that family and that child. So it's the regional center who places the child there, I believe, as well as the school district. But I think the regional center would be a great place to start. So they can be temporary services, but at least there'll be something there so that your family, can begin to integrate and what that's like with, the challenges that we face.
Great. Thank you so much.
Yeah.
We have a question with regards to telehealth screening and diagnostic assessments. Will the result of the assessments, whether indicating high risk of diagnostic clarity, be accepted by the regional centers for service access?
I think that's probably too technical a question to answer on this webinar, quite honestly. So let's follow up on that after.
Okay, got it. We're hearing from someone that students in their school district in California is getting distant learning programs, but they are not making accommodations or following IEPs and the services there. IEP completion for us was to be in the beginning of March, and the school district is not responding. What legal action do we have to get these done as my son is transitioning out of his current district and into another one for high school?
Oh my goodness, that's a complicated, district specific issue too. I would say document everything right now for sure, and I wouldn't sign anything or move forward. And I'm not providing legal advice, but just be very careful. Document right now. Things are kind of on hold when it comes to the delivery of special education, what that looks like, and we can certainly interact a little bit more after the webinar, but I want to be careful about specific special education questions.
Great. I'm going to stop there, and some of these I can reply individually, and then we'll have one more chance at the very end for any additional questions. So I'll work on some right now, and then we'll have a couple more that can get answered at the end.
Okay. All right, so at this point in time, Mary Ann Sullivan, who does outreach for Autism Speaks, is going to take over and talk a little bit about what we have available for families. So Marianne?
Sure, thank you very much. I just want to say, I know we have a few minutes, but also feel free to email me. My email is msullivan@autismspeaks.org. I know I'm talking to mostly California families, and I've been in California along with Tracy and Judith for many, many years, and I'm sure I know some folks on the webinar, and I'm proud to say that you're here today, that you're watching what we're offering to families, and glad that you could make it, because I know sometimes it takes quite a bit of effort to pull together to sit in a chair for an hour when you have kids and adults with autism at home. So I'm lobbying for movie theaters to be opened again because my son Hunter loves going to the movies, and it's really hard for him to understand that the movies are closed and that we're not going to be able to go. So I've come to recreating a movie theater in my home, so to speak, but doing the best we can. But I know for all the families that it's really challenging to have the student or the adult or the very young child at home and trying to think about what's best for them. So pat yourselves on the back. You're doing a great job. If there's anything I can do or Autism Speaks can do, please reach out to us. So I've just talked about the challenges in terms of disruption of routines and the access to services. It's very hard on people because we rely a great deal on our community, our team, our ABA providers, all those folks to help us get through the day and get through tough times. So lots of times right now we're not able to reach out and access them as easy as it's always been. Adults, particularly with autism, are cut off from the services and not able to go in the community. As I said, my son Hunter is 28. He has his routine and his, just where he walks in his neighborhood and those kinds of things. And everything has changed. Everything's up in the air. And it's asking a lot of people, I think, not everyone, but a lot of people with autism to be more flexible, to open, well, maybe tomorrow, or we could do this later, those kinds of things. And that seems to have worked for me. We have a tremendous amount of resources and support that's available. Could you go to the next slide? I think, I want to, without taking any more time, one of the most important resources I think that we have is the Autism Response Team. This is a national team that will answer your questions. Even if you need, as a parent, to pick up and talk to somebody, they will be there for you. It's not one of those things where you leave a message and they call you back in 2 weeks, or the phone's busy and you have to wait. The team's very responsive. They're well trained in lots of areas, and I promise you that they will connect back to you. I know for lots of families, just a way of thinking things through. Even though you're making your own decision, it's nice to bounce off information off of someone who's been trained and understands autism. So you can contact 888-288-4762. That's the Autism Response Line. Of course, we have a Spanish line, and then we also have an email that's available. Don't hesitate. No matter what, we're there for you. Is there a next slide? I know we're on the service and support team, and a lot of our folks who are credentialed and have had lots of experience with children with autism. There's a great video done by Ariana Esposito, and she's our Director of Lifespan Services, and just how to handle those challenges that I was talking about in the environment. What can we do to make things differently? What would satisfy their needs? And sometimes those things are not easy to come up with. So that's a great video that you can watch. This is our information and resource page. Again, this goes back to our webpage, www.autismspeaks.org. There's many resources on our page regardless, but with particular now with the coronavirus, we have had and added many resources. So I don't have to walk through those so much with you, but I know one of the things that I found really helpful is there's a social story on washing hands and staying healthy, and understand why you do that. I don't know if anybody can put that in the chat box, but it's a generic social story. It took me all of 2 minutes to switch out, put some pictures of my son in there and showing him hand washing. And we watch it in the morning, every morning. Works out perfect. So I can give you, there is a link to that. I don't know, Kelly, if you can offer that or if you have it, but again, we can put that into the follow-up letter. I think this is just a capture of our webpage. This just talks to you, it shows you really about information by topic. So you're having issues with wandering, you're having issues with personal hygiene, a number of things. It's too many topics, financial planning, health and wellness, all those kinds of things. You can go in and select that topic, and there's a myriad of resources that will come up. A lot of times the next step is to call the art team because you want to personalize it. And you can say, oh, I noticed on your transition page you talked about conservatorship. What do you think? Those kinds of things. So even though the information is there, sometimes all of us need somebody to talk to bounce ideas over. And that's why the art team is there for you. Thank you.
Thank you, Marianne. I'm not sure if there are questions for Marianne too. Kelly, do we have questions?
We have a lot of questions that are very individual in nature, so we'll try to get back to people or ask you to use the resources that were shared to reach the autism response team. We do have one that may be broader application that I'd like to mention now, and this may be for Melissa since it's California specific. Any support for those who need to apply for unemployment in the state? It's hard to navigate the system.
Yeah, we're hearing that across the board on unemployment. Obviously, the system is being flooded, and they are making efforts at the Economic Development Agency to address the flood that they're getting. Is the question specific to how to access it for any particular reason related to developmental disabilities, or is
I think it's more general.
And if that's the case, I think the answer is, the system is there. You work through their website, but it's simply going to take time. They are doing the best that they can. Their staff is running kind of around the clock, but obviously they are getting flooded with claims. I think in the last hearing that I saw, I can't remember exactly what the number was, but I think it was somewhere around a 14 or 15% increase in unemployment currently, people filing for claims. So again, it simply is just going to take some time.
Okay, thank you. Yeah, just keep trying. I've heard similar stories, and I know I have heard that because of the problems in getting through, often they're making things retroactive. So it's not like it won't happen. It's just a matter of getting through so you can file and then have it be applied retroactively as needed.
Yeah, that is happening here in California as well. It is retroactive.
Yeah.
Mm-hmm.
Let's see, we will be sending out these resources in an email within the next couple of days. So all of the registered participants will receive this. I think for the rest of these, I would encourage, many of these are specific to a family situation. We can save the Q&A and try to follow up with folks, and or have you reach out to our art team. So I think that covers it for now and gets us right to the end of the hour.
Yeah, thank you everyone for participating. Please do check your email because we will be sharing this with you. And I do want to encourage those of you who have asked more individualized questions that we didn't get to during this time. You can respond through the email when we send it to you. There's opportunity to respond. Or you can email me if you'd like. My email address is Judith, Judith .Ursetti, URSITTI @autismspeaks.org. And again, you will be receiving these resources. So if you didn't get that written down, you can respond to the email that we send you, and we'll follow up that way as well, because I don't want you to walk away without the information that you need. So thanks everyone for the time today, and we will keep you posted about everything that's going on the state and federal level and additional resources. Talk again very soon. Please take good care.